Good morning, everyone. So, can you just check whether are you able to hear me? Good morning, Daniel. Okay, thank you very much for addressing me. That's okay. You all can hear me. Okay, so today we're going to start again the session, the webinar session. We're going to continue with our speaking module once again. For people who have who are new to the webinar today, I would like to inform you that in the webinar session, I would really recommend if you could use a laptop or a desktop to view the webinar, as there is no problem in using any mobiles, absolutely fine. But the reason why I say so is because the reception on your mobile might vary here and there. So you might get an interrupted reception, but comparing using a laptop or a desktop, that would be more advisable. Okay, so and another thing I would like to just remind you about is if you have any questions during our session, you can ask questions through our chat podium that is towards the right hand side of your screen. All you have to do is type in the question, whichever questions, whether it's please don't be hesitant to ask any sort of questions, absolutely fine. So whatever is pertaining to the matter, I would definitely be able to answer your questions, and we would go through it. Okay. So today again, as I said, we are going to start again with the speaking module. Let's have a quick recap on what we have discussed yesterday. Okay. So let me just pull up the presentation. Yes. So we did discuss the different criterias of. Sorry about that. Okay. We did discuss about the different criterias of speaking, and what we are trying to do here is just to recap what we have discussed yesterday. So there, as we all know, as we have discussed yesterday, we have two criteria, that is the linguistic criteria and the clinical communication criteria. Okay, so let me just quickly tell you that the linguistic criteria comprises of four, and just give me a minute. Okay, so it comprises, as we discussed, the linguistic criteria comprises of four criteria. That the first one is intelligibility. So when we discuss about intelligibility, it is about the pronunciation. How do you pronounce the words and sentences while you're speaking, and how clearly you can give your communication to the listener. For example, by stressing, by using intonations, and also the rhythm of your speaking. All these things comes under intelligibility. So it's all about the listener understanding you very clearly. So you need to make sure that when you speak, it is quite easy for the listener to understand without any further strains. Okay. And the next one is fluency. So the next criteria we talked about was fluency, and it's the fluency comes in under fluency. There are different things which becomes in that is the speed of your speaking or your rate of speech. Okay, so that is a very important factor while you're doing your communication, and the thing is that when you do your communication, it is very important that you need to, as we talked in the first one, in the intelligibility. So the intelligibility, it states that we need to make the listener understand what we are speaking. So the speed or the pace of your speaking is very, very necessary. So if you go on a higher speed, or if you go on a higher um, pace, okay, it might be quite difficult for the listener to understand you, especially when it comes to the fact that if it's an elderly person whom you're speaking to, can really, really find it difficult to understand when you're speaking. So that is about fluency, and also using sufficient process, avoiding any sort of repetition. All these is counted under the criteria of fluency. Okay, so the thing is that when doing speaking, it is very important you have all these things in place. For example, you're having a very long pause in order to search for words or sentences which you are going to speak. That actually would bring down your score. Okay, so the serious thing is that when you speak, always make sure that you use the sufficient pauses, you use the sufficient um, stresses so that the listener can listen to you and can understand you very clearly. Okay, so with that, we are moving on to the third criteria, that is the appropriateness of language. Okay, so that is when we discussed about the appropriateness of language. It is, just give me a minute, please. Once again, sorry about this. Okay, so we talked about the appropriateness of language. Okay, when we are talking about the appropriateness of language, we need to make sure that we maintain appropriate register, tone, and lexis for the content. So when we talk about the right register, the right tone, the right way of speaking, the sounds, the high and lows of your sounds needs is very, very important in this case. So that actually makes you or the listener more flexible to listen to you, and it enables the listener to understand the thing in a very good manner. Once again, sorry about that. So basically, what you have to do is in appropriateness languages, you need to clearly maintain a tone and register when you are speaking. And you should also make the contents very, very simple when you're explaining. And also, you need to use the grammatical expressions very clearly. Okay? And another thing, the next one is the resources of grammar and expression. So in this, you need to use the different forms of vocabulary. So yesterday I discussed to you with regards to the different forms of vocabulary. It doesn't mean that you have to really, really, use high-end words or high-end, lexicals. So all you have to do is use very simple words and lexicals so that the other person understands you. And also, when you're using high-end words and or high-end lexicals, there could be a possibility of pronunciation errors. So unless and until we have the correct pronunciation and things like that, we wouldn't. It is quite good that if you don't dare to do that in while you're speaking, and also you know, to make the other person very much understandable what you are speaking, it is always good to use the words which are very easy to understand. So rather than using different forms or different high-end words, it's not that good to do that. So the other person might not even understand what you are speaking. Okay, and another thing, what it comes to the with regards to the resource of grammar and expression is that when you are speaking, using similar words, don't use repetitions of words when you're speaking. Try to avoid the repetition. Try to use the similar words while you're speaking. So with that, we conclude the linguistic criteria and we move on to the second criteria, which is clinical uh, the the clinical communication criteria. So let's quickly go through the clinical communication criteria. So that is we have total of 5 criteria in the clinical communication, and those are the first one is relationship building. Okay, uh, with regards to the relationship building is all about making the the listener or the person or the patient whom you are speaking to quite comfortable while you are doing your speaking. So basically, you need to make the person pretty much comfortable, and he or she should be able to openly give you his opinion or his sort of mindset things to you. So in order to that, how do we start with building up the relationship between the two people, so or between the patient? So for that, the first thing is you greet them, introduce yourself, and how you present things. All these things are matters. Okay, and also demonstrating a respectful attitude. Always respecting the person's point of view or mm, the patient's point of view, and also respecting his freeness or his or hers views. Okay, all these things needs to be looked upon, and also not approaching or using a judgmental approach. You should be always non-judgmental. You should be always having a non-judgmental approach. For example, not making sure that you don't judge the person in a state. For example, yesterday I illustrated an example of a patient when you're speaking to a patient and the patient has an habit of smoking. So you directly state, or you do not know whether he has a smoking habit or not, but you are stating that you need to stop smoking. Okay, so that actually is a judgmental uh, approach. So you need to avoid those type of approaches while you are speaking, and showing empathy towards the patient as well. For example, if a patient says that he is suffering from some sort of illness and things like that, or a state of mind, he states that the patient states that he or she states that he or she is depressed. Definitely, you should show the empathy factor or the emotional state. We need to recognize that emotional state I apologize for the interruption in between. I hope everybody could hear and view me right now. Is that okay? Could you just quickly give me an update whether you can view and whether you would be able to hear me clearly? Okay, that's very good. Okay. So, so we were talking about the relationship building, yes. So let's come back to the criteria, that is clinical communication criteria. So we talked about the relationship links, and all these things needs to be pointed out, or we need to follow to attain better scores when you are doing your speaking. So moving on to the second criteria in the clinical communication is understanding and incorporating the patient's perspective. So eliciting and exploring the patient's ideas. For example, you asking questions or picking up clues from the patient and addressing them is very necessary. Okay. You also ask the patient about his or her opinion about the thing which you're going to discuss, or about what he or she knows about this particular subject or a fact. Okay, so from that you are trying to attain some ideas from the patient. Okay, so that is what you would be doing by in the criteria of understanding and incorporating the patient's perspective, and also relating uh, explanations and ideas which the patient has put forward to you during your explanation, or relating those ideas while you're explaining. Okay, all these are comes under the fact of understanding and incorporating the patient's perspective. Okay, with that we move on to the third criteria in clinical communication, that is providing structure, which I would say is very important in this particular criteria. Okay, so providing structure means sequencing your speaking, or purposefully, or sequencing it in a proper manner or in a logical manner. When you start explaining, or when you start before you start with the after you do your introduction, after you do your you start with a greeting, you do your introduction, you ask the patient's concern. After understanding the concern, before you start with the advice, or if you are going to illustrate about an advice or about a procedure, it is always good that you give an idea to the patient, what are you going to discuss today? So that needs to be discussed while, or to be told to the patient upfront. So the patient or the listener is ready for for the discussion. He knows what is going to come next and what is going to come next. So the patient or the listener can, come up with adequate questions to you, or his doubts and things like that. It would make the patient with easiness, okay, or he or she would be quite comfortable to speak to you and discuss about the different matters. So providing a structure is very, very important. And also, when you're using some sort of technicalities into your speaking, or if you're going to explain about a procedure, or sorry, or if you're going to explain about the medical terms, or maybe if you're going to discuss about um, a blood result report, okay? And normally the patient, it is not very necessary that the patient does not know the normal levels and the higher levels. So we might have to explain that to the patient. So for that matter, you need to do that in a sequential manner, okay? So you need to take that type of approach while you are providing structure. And with that, we come to the fourth criteria, that is information gathering. So all the conversations goes along with after you gather, you give the replies or you provide information or advices after gathering the information from the patient. So in order to gather the information from the patient, the first thing you need to be an active listener. You need to first listen to the patient. You need to get the information. Okay. uh, Most of the times in your role play you will get an idea of the patient. Okay, on the role play card, it would be mentioned with a patient's details to some extent. Okay, so all you have to do, you don't have to illustrate the same details to the patient again until and unless it is quite necessary while speaking. All you have to get is to get information. Okay, based on that, you do your speaking. Is that clear? Or maybe the patient, for example, the patient is coming to see you with regards to a blood results report, as we had an example yesterday. Yes. So the patient knows that we have the blood test results with us. So definitely a quick word would help to to pass our information to the patient that, okay, as you might have got the blood results and we are going to discuss about this. Maybe he might not know what is the result stating in the blood test results, in his blood test results. So he needs to basically inform him about if there is any sort of abnormality than the normal levels. Okay, if the levels are higher than what is been expected. That needs to be conveyed to the patient in a very respectful and a non-panicking way. Okay. For example, when we gather the information, meanwhile we have to do that as well. Okay. You get the information from them by asking all these questions. So first we need to do is to listen to the patient without interrupting. I'm not saying with minimal interruption. Minimal interruption is fine, but do not completely interrupt the patient or the person while speaking, like completely stopping the patient from speaking. Maybe while he or she is speaking, what you can do is that you are not clear about what he or she said. In those occasions, definitely you can, pop in a quick question. Could you explain that a bit more? Maybe that those things. For example, he explained about something, and you are not that clear about that particular situation. Okay, for those purpose, you can definitely pop in a question that would you be kind enough to explain me a bit more, or could you illustrate those details a bit more? So all these things can be done, but with minimal interaction. So it doesn't mean that you are stopping the patient or the speaker from speaking to you. Okay, you're not cutting short of anything. Okay, and when you are gathering information, you also need to make sure that in the beginning, okay, you start with open-ended questions. So we discussed about what is an open-ended question yesterday and closed-ended questions. Open-ended questions are questions which does not answer or yes or no questions. So that is what an open-ended question is. So in an open-ended question, you ask a question and the person has to explain something. Okay, it is not that in a closed-end question, it is the answer would be a yes or a no. Okay, that is a closed-end question. So initially, when you start with your conversation, it is you have to use open-ended questions so that you grab all the information which is required to you, because that is what you do in the beginning. So the first thing you do, you're speaking, is to gather information, then you provide the information, right? So we need to get more information in the beginning, so we ask open-ended questions. But when you come towards the end of our conversation, when we are about to wrap up our speaking or speaking test, you can always move with appropriate closed-end questions. Okay, so that the patient does not prolong the speaking, or the interlocutor does not prolong the speaking for more than the time. Okay, so that would really help you. and and also the next thing in information gathering is not using compound questions, okay, or leading questions. um, Compound questions, it's basically meant that you asking questions mm, um, in like two questions together. You're making two questions together and shooting it to the uh, the person or the interlocutor. So you need to avoid that completely. Ask one question at a time, okay, so that the patient is for that for the patient can easily understand the question and reply with easiness. Okay, that needs to be done. And moving on to the fifth. Okay, sorry. Before that, also clarifying statements, vague statements. We need to, if certain statements from the patient is not so clear, you need to, uh, you know, you need to implicate. For example, you need to ask questions or clarify statements. You need to get a clarity before you provide the advice. So you need to be very clear about the statements which the patient or the interlocutor makes to you. Okay, that also needs to be there. And summarizing information to encourage correction and invite further information. For example, during your conversation, what you have to do is that once you do your active listening, you listen to the patient's statement, and all you have to do, you can quickly summarize what he or she said to you. Okay, so that the patient understands that you have gathered the informations correctly. Otherwise, the other person does not know whether you have got or whether you have understood the information which he or she has provided to you. So that is also a criteria within the information gathering, which you need to perform while you're speaking. And with that, we move on to the fifth one, that is information giving. Okay, so information giving is establishing initially what the patient already knows. So you need to basically ask. We did do the in the first one, the second criteria, that is understanding. We did try to explore about the patient's if the patient knows about this particular disease or anything as such. We ask with questions and things like that. So once we have that information, we need to initially start with the information the patient already knows quickly, as you know this is what it is. So you try to connect between those information and you start your speaking. Okay, the conversation. So that is how you start with information giving. So you're connecting with what the patient knows about this particular condition. Okay, and pausing periodically when you're giving information. You also need to pause periodically when giving information, so that the benefit of pausing is that when you do pause and speak, it is very important. It is very good that the patient understands it very clearly. Okay, after giving someone information, a slight pause would help uh, for the patient to get or grab those things into his memory. Okay, and responding using the guidance by the next step. For example, you give an information and you check with the patient or the person that whether he or she has understood what you have just discussed or told him right now, him or her just now. Okay, so getting a response so that you are making sure that information is being very clear to the patient. And also make encouraging the patient to contribute reactions and feelings. Maybe after giving giving the information, you may ask a quick question like, how do you feel about this, or do you think you will be able to cope up with the situation? For example, if you are providing with a dietary regimen to the patient, or you're requesting the patient or suggesting the patient to move on to some sort of diet. So when you put that into place, you ask the patient that would this be okay? Will that be okay with you? So all these questions. So he or she can contribute his or her feelings or emotions related to or reactions towards this particular concept which we are just putting forward to the patient or the interlocutor. Okay, and checking whether the patient has understood the information. Yes. So when during your conversation, you can slightly check with the patient whether he or she has understood what you have told. When you come towards the end of your information, or when you finish with providing the information, you may ask the patient or the whoever is there sitting in front of you, if you would be able to summarize what the information has been told by yourself. So from by that way, you can also make sure that information provided to the patient is very clear. Okay, so that actually is one of the criteria which we have in this clinical communication criteria. So with that, we just have a quick recap on what we have, discussed yesterday. So I hope everybody is clear about this particular criteria in speaking. Okay, I do see that a lot of yes coming in. Okay. Okay, so with that, let me tell you today's plan, which we are going to do with regards to the speaking, webinar. So after this recap, I would be playing you a video with the audio of a sample clinical communication. Okay, so it is just it gives you an idea about how you can do your speaking. So this is a conversation, or an example of speaking between a doctor and a patient. Okay, so watch very closely with regards to the speaking and see what all criteria have been met, okay, through this particular speaking. So we have discussed about these two types of criteria, as the linguistic criteria and the clinical communication criteria. So first listen to it, then maybe if you want to listen to that again, I could play that again for you. Okay, so are you all ready to listen to this particular video and audio? Yeah, okay. So let's be prepared. Okay, listen very carefully. If you would like to take notes, you can take a note with a paper and a pen and see what all criteria have been met through in this speaking during this, video. Okay, so very closely listen to this.
Come in. Mrs. Olsen.
Hello, Doctor.
Hello, I'm Dr. O'Connor.
Hello.
Would you like to take a seat?
Yes, thank you.
How are you today?
Oh, Doctor, I've not been feeling very well at all. Feeling really tired and run down, and been having this breathlessness, and I've really been worried about it.
You came in to see one of my colleagues about that recently, didn't you?
I did, yes.
And she sent you for a blood test.
That's right, Doctor.
Yeah. We think you might be anemic.
Oh gosh. Yes.
So what I wanted to do today was firstly to give you your blood test results.
Yes.
And then talk to you a little bit about the condition of anemia.
Right.
And then talk about some potential treatments.
All right, Doctor, yes.
Does that sound okay with you?
That sounds fine, yes, Doctor.
Great. So should we have a look at your blood test results?
Yes, yeah.
Here it is. So what we're testing for is the level of haemoglobin in your blood.
Right.
And just to show you, the normal range for women is between 11.5 and 16 grams per decilitre of haemoglobin.
Right.
And this is your level of haemoglobin. It's 8.7.
Oh, that's low, isn't it?
It's a bit lower than we would like.
Oh dear, yes.
So what we'll be looking to do is to get that back within the normal range.
Right, okay.
Just to reassure you, iron deficiency anemia, which I think you've got, is fairly common. Up to around 15% of women can experience this type of anemia.
Right.
And it's very treatable as well.
Yes, yeah. Yeah. Oh yes, I mean this tiredness is just getting me down, Doctor.
It must be. It must be, because you've got quite a busy lifestyle,
I
haven't
have,
you?
yes, yeah, and I just feel as though I can't cope much longer with it.
Okay.
Yeah.
Shall I tell you a bit more about anemia? Do you know anything about the condition?
I don't know. I mean, I've heard of it, but I don't know what it is.
Well, it's a condition related to your blood.
Right.
And within your blood, there's several components, one of which is plasma. Within the plasma, you have your red blood cells.
Right.
And within that, you have a protein called hemoglobin, which carries the oxygen around your body to all the different organs.
Okay.
Now, if that's not working efficiently, you start to experience the kind of symptoms that you've been having, like breathlessness, dizziness, tiredness.
Yeah, definitely. Yes.
One of the causes can be blood loss. So I wondered about your periods. How are they?
Well, they've been heavy these last few months,
Have they?
really heavy, yeah. I put it down to my age, you know, they start getting irregular and heavy. But you might be right there, yes.
That may be a factor.
Yeah.
So I want to talk to you about treatments now.
Yes.
There are a couple of things that I would suggest that you try. The first thing we'd like you to do is to increase the amount of iron in your diet. Can you tell me a bit about the sort of diet you have at the moment?
Well, I mean, I'm really busy. I think they have a reasonable, you know, a well-balanced diet. We eat a lot of ready meals. And then on a weekend, we always have a good breakfast. We always cook bacon butties. You know, so I think it's quite a good diet.
Right.
Yes.
Your teenage children, they keep you busy.
Oh, they do, yes. I mean, you know, it's like having a taxi service. You what with that and then at work, you know, I'm so busy at work. It just so tired.
So if you're feeling tired, it must be hard for you to do all those things.
Yes, it's difficult. I just feel as though I can't cope anymore.
Now, you mentioned ready meals. I can understand you relying on those for convenience, but the problem is sometimes you don't get the proper balance of nutrients.
All right, Doctor.
So what I'd ask you to do is perhaps to adapt your diet slightly and include more iron-rich foods in your diet.
Oh, right, okay.
Before I tell you about what some of those foods are, can I ask if you're a vegetarian?
No.
You're not?
No.
The reason I ask that is because one of the best sources of iron in your diet is lean red meat.
Oh, yes, yeah, like steak.
Yeah, exactly.
Right.
Also, liver is a good source.
Oh, no.
You don't like liver?
No, couldn't eat liver.
What about something like steak that you mentioned? Would you consider eating that a bit more regularly?
Well, yes, I mean, steak wouldn't take long to cook, would it at all? Yeah, we could give that a go.
Good.
Yes, yeah.
There's also leafy green vegetables. Things like kale and spinach are good sources of iron.
Oh, the kids wouldn't eat that. Oh, no. But, I mean, they like sweet corn, so they could have the sweet corn, couldn't they, with the steak? And I could go for the leafy, the green vegetables.
Do you think you could give that a try?
Broccoli, so it's broccoli.
Yes,
broccoli. I like broccoli, yes.
Oh, good.
Yeah, I'll have a go with that.
Okay. There's other things too you might want to consider. Things like fortified cereals, which have iron.
Oh, right.
In
What
them.
are those?
Well, if you look on the ingredients panel of cereals, you'll see some are enriched with iron, so you could perhaps incorporate some of those.
Oh, yes, I'll have a look at the supermarket. I mean, if I got some of those, we could have that at weekend, and that'd give me more time. I wouldn't have to cook, would I?
Could make your life a bit easier.
Yeah, definitely.
That would be a help, wouldn't it?
Yeah, it would, yes.
Wholemeal bread is a good source of iron as well.
Oh, yes. Yeah, no, they only like white bread. I only normally buy white bread. But I could buy myself some brown bread cobs and have it for lunch. Yes, yeah.
Oh, good. So do you think you could give some of those things a try?
Yes, I would try, Doctor, definitely.
Great. The other thing I'd like you to consider is taking a course of iron tablets.
Oh, I'm not into tablets. Why?
Okay. This can be a really effective treatment for iron deficiency anemia.
Right.
And what it does is it supplements the amount of iron you're getting in your diet.
So would that be short term?
Yes. Often people respond very well to those. You can have some side effects.
Oh dear.
Sometimes they can upset your tummy if you have them on an empty stomach. So what you do is you take them after a meal.
Oh right. Yeah, I'd remember to do that. Yes. Yeah. Yeah.
But I think those two things, adapting your diet and taking a course of iron tablets, I think you might respond very well to those treatments.
Yes, yeah. I'll have a go at that, Doctor.
How do you feel about the information I've given you so far?
That's fine. Yes, I'll definitely try. If it makes me feel any better, it's worth it.
Yes, excellent.
Yeah.
Excellent. I've given you quite a lot of information about anemia today. I've got a leaflet here about anemia, which I thought you might like to take home and read in your own time.
Oh, thank you. Yes, yeah. Oh, yes, yeah. I'll read this, Doctor. It's sometimes difficult to remember what you tell, so yes, having a look at this at home would be really helpful.
That's right.
Yes, thank you.
That's right. So just to check that I've explained things to you correctly, do you think you could just recap on the two treatments that you're going to try?
Well, you said that the anemia is due to a lack of iron, and I can get this from having some red meat. I mean, steak, lamb chops, would that be?
Yeah, trim the fat off.
Yeah, and green vegetables, and wholemeal bread. And if I have these iron tablets, that, hopefully I'll feel better. Thank you, yes.
Excellent. So what I'd like you to do is come back in a couple of weeks and then we can see how you're doing.
I'll do that, yes.
Yeah. Have you got any questions?
Well, are there any other tests I'll have to have?
I think at this stage, when you come back to see me again, we'll do another blood test and check on your hemoglobin level then. If it hasn't gone back into the normal range, it might be then that we'd look at doing some other investigations. But I don't want to worry you about that at this stage. I think let's see how you do with the dietary change in the iron tablets, and we can discuss that next time.
Right, thank you, yes.
Is there anything else?
No, I think that's it, thank you.
Okay, well, good to see you, and I'll see you again in a few weeks.
Okay, thank you.
Bye.
Bye.
ഡാഡി അപ്പുറത്ത് പോയി സംസാരിക്കാവോ? I hope everybody was able to hear the video. I see that Kavita did had some issues with the sound. Did anybody experience the same? Okay, some disturbance there while in the video. Okay. Okay, I think the sound was completely full. That is what I have actually done, but maybe because of the the speech, the way they speak, especially the slang, it is quite difficult to understand when we are not used to those type of English speaking slangs and things like that. Okay, so this is where the the tone or the register really comes into play. For example, you speak with different register and tone, so the voices go up and down while speaking. Certain areas you have a higher sound, the certain areas you have a lower sound, as if like you do or singing. Okay, while when a person sings, yes, the register at times goes up and down. That makes it more pleasant, right? So all these things matter. So what did you feel about this speaking? So have you got an idea about speaking after watching this video? Okay, I see that during the video, you might be able to look at some of the criteria which already OET has been set. So were you able to notice that? or were you just listening to the speaking alone? So did you get a chance to notice that? If you want, do you think that you want to listen to that again? If you would like, I can play that again so that you could notice those, criteria, whether these criteria have been met and how are they being, followed in the, you know, in this speaking sample. I do have, Murugan, I do have, other sample videos with me, but what I'm planning to do today is that to view on this, I think most of the criteria are being, focused or illustrated in this particular video. That's why I picked up this particular video so that we could have a discussion. mm, you know so I do have a person requesting to put the video once more so that it would be really helpful. Okay. Yeah. Okay, I do have him responding as greeting and established rapport, positive reassurance. She gathered info with open questions and active and reflective listening and summarized by restate by patient. Okay. Restating by the patient. Yes. Okay. So yes, Hima, you have noticed that. I hope everybody would have noticed that. So, is there anybody who would like to listen to the video once again? Okay, I do see a couple of people have requested to view the video again. Mm, what we will do is like I would put the video again, and in between I will pause and we will have a discussion on that as well. Okay, so I think that would make us or everyone to understand how they have prompted their speaking or how they have used certain words and things in the speaking. Okay, so let's quickly watch the video again, and in between, while we are speaking, I will also pause on the certain areas so that we could have a bit more clear understanding on this particular video and how to do speaking for yourself. Okay, let's play the video once again.
Come in. Mrs. Olsen.
Hello, Doctor.
Hello, I'm Dr. O'Connor.
Hello.
Would you like to take a seat?
Yes, thank you.
How are you today?
Okay, so did you listen the first portion? That is, the doctor actually greeted or the person, and she started with her name, and also she asked whether she is speaking to the right person. Yes, so those identification, it was just like the start of a rapport building. Yes, and which made the patient quite comfortable in the beginning itself. So have you all noticed that? Okay, and also she did not phrase the question like this. For example, are you Mr. Are you Miss so and so and all? So that wasn't it. So she just prompted with Miss so and so. So she said yes. So this is what the difference between in your speaking. Okay. So at times you don't have to have that big sentence to be made. You can make it short while speaking. Okay, but when you're writing, definitely you have to have the sentence incomplete, but in a complete form. But when you're speaking, you can bring it down, okay, so that the other person understands and gives you the answer. Okay, so this is how you start with your speaking. Okay, I'm not saying that you completely follow this type of speaking. Make your own style of speaking. Okay, don't copycat the way the person just did on the video. Okay, so try to improvise by yourself by having a good format, or maybe a format, or maybe a set of formats which you do by yourself. So and keep on changing that. Okay, that would, I'm not saying that you follow a format. Don't please follow any sort of format. But if you practice different ways of introduction and greeting and things like that, that would be really handy to you on different scenarios. Okay, so focus on that. So try to write down those dialogues and repeat that. Who has some sort of difficulty in constructing sentences and words? So write it down, make a correction with someone who knows the sentence construction is right, and try to get that into your head. So when a situation arises of different scenarios, you can apply that while you're speaking. Okay. So let's move on with the video then.
Today.
Oh, Doctor, I've not been feeling very well at all. Feeling really tired and run down, and I've been having this breathlessness, and I've really been worried about it.
You came in to see one of my colleagues about that recently, didn't you?
I did, yes.
And she sent you for a blood test.
That's right, Doctor.
Yeah.
Okay, here what I want to talk to you about is how she did ask that question about, she just asked how the patient is feeling. Okay, so she started with her current situation, and she started, giving more information. From there, the patient or the doctor started getting the information, and she does not make any interruption in between. She just makes minimal interruption so she gets more information, or she asks, open-ended questions, not short-ended questions, which she gives more information to the doctor. The patient gives more information. Yes, so she illustrates the situation, and she makes her makes her more comfortable, and she just states what had happened earlier and things like that. That depends upon each scenario. You don't have to, at times you don't have to take back the history or what had happened earlier and things like that. Stick on depending upon the scenario. Okay, so let's go with the video again.
We think you might be anemic.
Oh gosh. Yes.
So what I wanted to do today was firstly to give you your blood test results.
Yes.
And then talk to you a little bit about the condition of anemia.
Right.
And then talk about some potential treatments.
All right, Doctor, yes.
Does that sound okay with you?
That sounds fine, yes, Doctor.
Great. So should we have a look?
Okay. With that, if you have noticed, the doctor actually, did structuring, right? She structured what she is going to do today, or what is she going to speak today with the patient. So the patient knows that what are they going to discuss today. So yes, structured speech, that's one. So when you are doing your conversation, it is very important that you structure your speech. Okay, what are you going to talk about? Okay, what are the concerns here? For example, this is something where the doctor is going to illustrate about the treatment plan, or what the patient needs to do. For example, let's take another situation here, or another scenario. Maybe let's think about the patient is having some sort of complaint, okay, with regards to some sort of treatment plan, or in a hospital environment. Okay, so how are you going to structure that? Okay, first you listen to the patient's concern. So what are you going to do is that you paraphrase the concern. Then you would tell the patient that, okay, I understood, I do see that this is what your concern. we would look at the concern first. What are the causes to the concern? What are the things which we could do to avoid this, and what are the things which he or she should be doing to avoid any further concerns. Okay, so we would structure the speech and put it forward to the patient, and we would ask if he or she is ready to go further with this discussion. We ask the permission of the patient or the listener to further go ahead with the discussion. Okay, so this is how we do our conversation. So let's look at
so should we have a look at your blood test results?
Yes, yeah.
Here it is. So what we're testing for is the level of haemoglobin in your blood.
Right.
And just to show you, the normal range for women is between 11.5 and 16 grams per decilitre of haemoglobin.
Right.
And this is your level of haemoglobin. It's 8.7.
Oh, that's low, isn't it?
It's a bit lower than we would like.
Oh dear, yes.
So what we'll be looking to do is to get that back within the normal range.
Right, okay.
Just to reassure you, iron deficiency anemia, which I think you've got, is fairly common, up to around 15% of women.
Okay, so I would like to stop here again and see, out here the doctor was explaining the clinical terms, right? So it's not very necessary that all of the common men or the patients would understand every clinical, facts, or maybe understand blood test results. By maybe at times, the patient might not have an understanding by looking at the blood test results which they receive. So it is very important at times to explain that. So not every situation, certain situations. Okay, when there are in the scenario, if for example, if in the scenario, if they are given with the let's say the figures of the test, okay, then it might be quite good if you could explain that to the patient in a layman's language. So the way the doctor presented this was on a layman's language. So what the doctor did was, she said that this is what the result, I have the result in front of me, and she said that this is the result about the hemoglobin, right? And then she explained what is the normal level. Then she showed the test results. So the patient understood that there was some sort of abnormality, and she said that straight away. Yes. So, and with that, she also anticipated the patient's concern. Yes. And she anticipated there was a concern the patient had, because when you normally hear that there is some sort of abnormality, definitely the patient would have some sort of anxiety towards that. So the doctor started reassuring the uh, the the condition. Okay, generalize the condition. Yes, Hema. So generalized the condition and said that this is a common thing which happens with normal people, and she reassured that this could be overcome. Okay, this can be overcome, through certain other things. So that is what he's going to explain.
To around
later on.
15% of women can experience this type of anemia.
Right.
And it's very treatable as well.
Yes, yeah. Oh yes, I mean this tiredness, it's just getting me down, doctor.
It must be, because you've got quite a busy lifestyle,
I
haven't
have,
you?
yes, yeah, and I just feel as though I can't cope much longer with it.
Okay, what I want to stop here and state to you about the empathy factor. I don't know if you would have noticed that. See, she just stated that she is stressed and she is having difficulty in that. And the doctor straight away empathized with her, right? She said, okay, I understand. Yeah. So this is where you empathize. So you look at or you get the idea, or you come to know that the patient is having some sort of emotional feeling, and you empathize with the patient. Okay, so you're not maybe at times you cannot just say that I understand your point. No, I really could understand, or I could really make out from your words that how you would be feeling at this point of time. So that could be some sort of assurance or empathizing fact which you could place when a conversation happens. So I want you to look at those things when you're speaking as well. Okay, so let's continue with the video.
With it.
Okay.
Yeah.
Shall I tell you a bit more about anemia? Do you know anything about the condition?
I don't know. I mean, I've heard of it, but I don't know what it is.
Well, it's a condition related.
Okay, again, I want to stop here. Here again, the doctor places some questions and checks if what she knows about this particular, disease or maybe about anemia. She just asks questions and gets the information from her whether she knows anything about it. Okay, so that it makes makes it easier for the doctor to explain. So you don't have to actually when you get those ideas from the patient, it is quite easy for you to explain them because you don't have to really read. You can decide by yourself whether you needs to explain it in very simple words or whether you need to explain it in a different way. So you can decide how you can explain these things. If the patient has some sort of an idea about this particular disease or things, then it will be easy for you to explain or to adapt an idea of how to explain to the patient. Okay, so let's again see the video again.
Condition related to your blood.
Right.
Within your blood, there's several components, one of which is plasma. Within the plasma, you have your red blood cells.
Right.
And within that, you have a protein called hemoglobin, which carries the oxygen around your body to all the different organs.
Okay.
Now, if that's not working efficiently, you start to experience the kind of symptoms that you've been having, like breathlessness, dizziness, tiredness.
Yeah, definitely. Yes.
One of the causes can be blood loss. So I wondered about your periods. How are they?
Well,
okay, again, I would like to pause again with this video. See, here the doctor pauses and checks if she has the understanding of what she has said right now. Yes. So she makes a pause here so that the patient, seems to understand what she has told her. So this is where another criteria has been, applied, or another thing has been. So again, if you do like this, definitely you'll be able to score better in your speaking. Okay, so let's come back to the video again.
Well, they've been heavy these last few months,
Have they?
really heavy. Yeah, I've put it down to my age. They start getting irregular and heavy. But you might be right there. Yes,
That may be a factor.
Yeah.
So I want to talk to you about treatments now.
Okay, so again, so she asked about her periods, and she illustrated that she said that the patient said that maybe this is due to her age. She thought it was due to her age and things like that. Did you listen? Did you notice how the doctor replied to that? So she used a non-judgmental approach there. She did not judge the fact that this is because of the periods, the loss of blood because is due to the periods is because of this particular disease. She was not judgmental here. Yes, she did not say that this is why it is there. She just said that maybe, yeah, or this may be one of the factors. So this is how we present. So you shouldn't, yes, him as she said is maybe. So this is, in this way you are non-judgmental. You were not, the doctor wasn't judgmental in her speaking. Okay, so please make sure that when you speak, you are never ever you put in a judgmental statement. Okay, so never ever state something that you confirm that okay, this is what it's because. Okay, so never state that. Okay, so let's again listen to the conversation again.
Yes.
There are a couple of things that I would suggest that you try. The first thing we'd like you to do is to increase the amount of iron in your diet. Can you tell me a bit about the sort of diet you have at the moment?
Well, I mean, I'm really busy. I think they have a a reasonable, you know, a well-balanced diet. We eat a lot of ready meals. And then on a weekend, we always have a good breakfast. It was cooked bacon butties. No, so I think it's quite a good diet.
Right. With
Yes.
your teenage children, they keep you busy.
Oh, they do. Yes. I mean, you know, it's like having a taxi service. You what with that and then at work, you know, so busy at work, it just so tired.
Just if you're feeling tired, it must be hard for you to do all those things.
Yes, yeah, it's difficult. I just feel as though I can't cope anymore.
Now, you mentioned ready meals. I can understand you relying on those for convenience, but the problem is sometimes you don't get the proper balance of nutrients.
Okay, again, I would like to stop here. Again, you know, she asked about the dietary pattern she follows with regards to her, you know, diet. So, Achu, അടങ്ങിയിരുന്നേ അച്ചു. So she follows a dietary pattern. First the doctor did is that she asked what her dietary pattern is, so that she could understand and give advices accordingly. So rather than stating that okay, rather than directly going and stating that you need to do this dietary pattern straight away and saying that yes, what if the patient says that I follow all these things here, and rather than stating that see, you know, what doctor was trying to do here was she was trying to see if there is anything which she is following can be advantageous to the you know, the conception of or taking in of iron. Okay, and she found that, obviously, yes. So it was quite easy for her to make her or the patient understand very clearly. Okay, so this is how, and again, she also did empathize. Again, she found where the patient said that it was quite difficult for her to cope with. So she again illustrated the empathy fact on the, you know, this during the conversation. So let's look at the other thing. Okay.
Nutrients.
All right, doctor.
So what I'd ask you to do is perhaps to adapt your diet slightly and include more iron-rich foods in your diet.
Oh, right, okay.
Before I tell you about what some of those foods are, can I ask if you're a vegetarian?
No.
You're not? No. The reason I ask that is because one of the best sources of iron in your diet is lean red meat.
Oh, yes, yeah. Yeah, like steak.
Yeah, exactly.
Oh, right.
Also, liver is a good source.
Oh, no.
You don't like liver?
No, couldn't eat liver.
What about something like steak that you mentioned? Would you consider eating that a bit more regularly?
Well, yes. I mean, steak wouldn't take long to cook, would it at all? Yeah.
Okay. So again, looking at that, she actually, you know, asked several questions and got some information during her speaking. And you know, she said that the patient said that she loved to eat steak. Yes, and the doctor, what normally people candidates do is like, okay, that is good. So I would recommend, or I would say that you need to take a lot of steak into your diet. So, but the doctor, what she stated, she respectfully, you know, pointed out, saying like this. I would really say that if you could consider, okay, so we are not forcing, or she is not forcing the patient to take this in her diet, but she is requesting or putting in a statement that whether if she could consider taking steak more, you know, more often in her diet, or include that in her diet. Okay, so that is what one I want to do, you know, put forward to you.
Give that a go.
Good.
Yes, yeah.
There's also leafy green vegetables. Things like kale and spinach are good sources of iron.
Oh, the kids wouldn't eat that. Oh, no. But, I mean, they like sweet corn, so they could have the sweet corn, couldn't they, with the steak? And I could go for the leafy, the green vegetables.
Do you think you could give that a try?
Broccoli, so it's broccoli.
Yes,
yeah,
broccoli.
Yeah, I like broccoli, yes.
Oh, good.
Yeah, I'll have a go with that.
Okay. There's other things too you might want to consider, things like fortified cereals, which have iron
Oh, right,
in
what
them.
are those?
Well, if you look on the ingredients panel cereals, you'll see some are enriched with iron, so you could perhaps incorporate some of those.
Oh, yes, I'll have a look at the supermarket. I mean, if I got some of those, we could have that at the weekend, and that'd give me more time. I wouldn't have to cook, would I?
Could make your life a bit
easier.
Yeah,
definitely.
That would be a help, wouldn't it?
Yeah, it would, yes.
Wholemeal bread is a good source of iron as well.
Oh, yes. Yeah, no, they only like white bread. I only normally buy white bread. But I could buy myself some brown bread cobs and have it for lunch. Yes, yeah.
Oh, good. So do you think you could give some of those things a try?
Yes, I would try, Doctor, definitely.
Great. The other thing I'd like you to consider is taking a course of iron tablets.
Oh, I'm not into tablets. Why?
Okay. This can be a really effective treatment for iron deficiency anemia.
Right.
And what it does is it supplements the amount of iron you're getting in your diet.
So would that be short term?
Yes. Often people respond very well to those. You can have some side effects.
Oh dear.
Sometimes they can upset your tummy if you have them on an empty stomach.
Yeah.
So what you do is you take them after a meal.
Oh right, yeah, I'd remember to do that. Yes, yeah.
But I think those two things, adapting your diet and taking a course of iron tablets, I think you might respond very well to those treatments.
Yes, yeah. I'll have a go at that, Doctor.
How do you feel about the information I've given you so far?
That's fine. Yes, I'll definitely try if it makes.
Okay, so again, I would like to interrupt with regards to the speaking. So towards the end, after she has finished with her, advices, so she did ask about, if these options could be followed by the patient, and the patient responded very clearly that. So you ask a question, so rather than just giving an information and leaving it does not make any sense, right? So we need to make sure that whatever information you have given, whether the patient would be able to follow it or not. So that is what you are trying to do as a health professional here. So that is what doctor did. Okay, so let's look at the video again.
Try if it makes me feel any better. It's worth it.
Yes, excellent.
Yeah.
Excellent. I've given you quite a lot of information about anemia today. I've got a leaflet here about anemia, which I thought you might like to take home and read in your own time.
Oh, thank you. Yes, yeah. Oh, yes, yeah. I'll read this, Doctor. It's sometimes difficult to remember what you tell. So, yes, having a look at this at home would be really helpful.
That's right.
Yes, thank you.
That's right. So just to check that I've explained things to you correctly, do you think you could just recap on the two treatments that you're going to try?
Well, you said that the anemia is due to a lack of iron. And I can get this from having some red meat. I mean, steak, lamb chops, would that be?
Yeah, trim the fat off.
Yeah, and green vegetables and wholemeal bread. And if I have these iron tablets, that, hopefully I'll feel better. Thank you, yes.
Excellent. So what I'd like you to do is come back in a couple of weeks and then we can see how you're doing.
I'll do that, yes.
Yeah. Have you got any questions?
Well, are there any other tests I'll have to have?
I think at this stage, when you come back to see me again, we'll do another blood test and check on your hemoglobin level then. If it hasn't gone back into the normal range, it might be then that we'd look at doing some other investigations. But I don't want to worry you about that at this stage. I think let's see how you do with the dietary change in the iron tablets and we can discuss that next time.
Right, thank you, yes.
Is there anything else?
Chachu? Okay, so I hope in this video, we have completed the video. Towards the end, yes, the doctor even asked the patient that if she had any further questions. Yes, at times we miss to ask those things when you're doing your speaking. So it is very necessary that if there is any further concerns other than this, through the discussion. So it is very important that if you could ask, that type of question, and we can clarify that if it is within that. Okay. So I hope the video was quite useful to you all. And do you have any questions pertaining this particular video or anything with regards to the speaking? self-monitor is clear. Any questions you have with regards to? No, no, okay, clear. Okay, I hope until now you all have got an idea about how speaking needs to be done. Okay, so with that, we would move on to the next topic or the next thing that I mentioned to you, that we would also take a role play card, which would help us to look forward or do our speaking in a better way. So let's quickly look on to a role play card. I will just put it onto the screen straight away. Give me a minute. Okay, so here we are with the speaking role play card. Okay, so the setting is basically a home visit. So the nurse, it is a nurse, okay, and a patient. So it's a home visit where the nurse visits the patient. Okay, so I think you can just quickly go through the speaking role play card. If you could just go quickly read through it, and you can have a quick understanding of this. So you can take a few minutes to read, okay, and the task. Then we would do the discussion. So once you're all ready with finished with your reading, and if you have understood the setting, please let me know, so then we can start with our discussion. Okay, I hope everyone is ready. So let's quickly go through the role play card. Okay. So what I want you to do is that you all understood the setting. So you are the nurse, okay, you're visiting a child, a 6-week-old child named Clara, to perform the preliminary health checks to assess the child's development. Yes. So, hearing, vision, height, and weight are normal. Now you want to provide the child with its first vaccinations. Okay. So this is the setting. So these are the things which or these are the things which you have been already been, advised with the role play card. Okay. So look at the task. Let's look at the task. So, okay, before we go through the task, okay, let me ask you a quick question. Yes, how do you introduce, or how do you start with the conversation? So yes, you definitely do the greeting, good morning, um, good morning, good afternoon, good evening, whatever it is. So let's say good morning, okay, and how do you present yourself? Yes, Biji, I hope that yesterday when I spoke to you all with regards to the speaking, when you introduce yourself or when you're doing your speaking, you never ever use sir, madam, ma'am while you're doing, okay? So you always address the person with with their surname or first name, depending upon how they want them to be addressed. Okay, so never ever use madam, ma'am, sir, any sort of those addressing. So you need to either address with the surname or the first name, depending upon whichever ways they would like to be addressed. Or you can even ask with that. Okay, so Vijay, try to avoid or completely avoid the usage of man. Okay, okay. So you all know that you start with you're speaking in the way of good morning. You start with a greeting, good morning, and you introduce yourself. My name is so and so. I am from where? Where are you from? Okay. I'm one of the nurses in your health community, in your community health center. So it is not their community health center, right? It's the from the community health center. Okay. So you need to do that. Is this Clara's home? Yeah, okay. Absolutely fine. Yes, okay. Yeah, you need to identify whether we have reached at the right place. Yes. So they say that yes, no, and all things. Okay. Um, so this is how you need to. Okay, first you introduce as you do your greeting. You then start with stating that my name is so and so. I am one of the community health nurse. Uh, visiting you to assess your child Clara's development. Okay, okay. So this is how you start with. Okay, that's fine. Okay, is it the right time to speak with you? Yes, absolutely fine. You can use different ways of introducing and building up rapport between the patient. Yes, trying to talk to you. Fine, fine, absolutely fine. I'm here to assess your child, Clara. Absolutely fine. Maybe after using that, is this the right time? As one of the candidates just mentioned, is the right time to speak with you, and things like that. Yes, you can. Good morning. I'm Sheetal, one of the community nurse to perform um, your preliminary health checkup. No, you need to be very specific. It is not the child does not come and open the door for you, right? Okay. So definitely you will not be speaking to the child. You'll be speaking to one of the child's carer, maybe to a mother, a grandmother, or maybe somebody, whoever else is going to take care of the child. Okay, or maybe um, uh, maybe the father who opens up the door. Okay, so it is always better that you say that you have come to perform the primary check up for Clara. Okay, So, you need to be very specific. Otherwise, they would think that you have come to check up their, health. So you need to be very specific on that. Yes. Um, okay. Hello. Good morning. I'm Hema. Okay, one of the community members. Yes. 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 How are you feeling? How you feeling today? Came to us as baby Clara. Clara's growth and initiate vaccination. Okay. So, okay. Good morning. My name is Tina. I'm one of the registered nurse from the community center. Is this Clara's home? Yes. Am I right? Is that the right time to talk with you regarding the development of your daughter? Fine. 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 Came to check your child Clara's health. Check it. Okay. Okay. Sheetal, I think you need to slightly modify your sentences, sentence construction. Okay. My name is Linu and one of the community health nurse. Is this mother of Clara? Okay, when you ask that question, is this? So you're actually pointing out to someone, not in a polite way. So you need to be a bit more polite when you're putting that question in. Am I speaking to Clara's mother? That would be a good question, Linu. Okay. Okay. Yeah. Yeah. So I think most of you have got the idea of assess your child, Clara, and also to provide vaccination. Okay, so this is good. Okay, so I think most of you have got the introduction, right? Okay, Shrika has said, hello, good morning. I am Shrika, one of the community health nurse in your category. How are you feeling today? I'm here to assess baby Clara's growth and initiate vaccination. Do you have any idea about the vaccinations? Yes, so that is good start. Yes, Shikha. So with a good morning, my name is Bhavika. I'm one of the community nurse to assess your child status. Good morning, I'm Dana Raju. I'm one of the community Dana Raju nurse. Okay, that's absolutely good. Yes, yes, yes. We have Sandra typing in. Absolutely good. Yes. Okay. 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 So I hope most of you have got the idea of introducing yourself and getting the getting into that hang. So as I said, when you see different case notes and things, or sorry, different uh, role play cards, try to make your own um, you, you know greetings and your own style of things. Okay, so make different scenarios, look at different scenarios and try to create so that it would be very useful. Write it down and read it out very loudly so that it gets into your head, so you could use it on different occasions, maybe um, like this. There would be different scenarios. Some at times home visit, as we did yesterday, maybe a hospital ward, maybe a patient coming to a clinic, all these things. So try with different scenarios, write it down with the starting, that is introduction, the greeting, the introduction, how you would start the conversation or how we would initiate the conversation with. Okay, I'm here to do the 6-week assessment of your baby Clara development review. Okay, So, Sandra, what I would also try to, I would request you is that, or in general, I would like to tell you all that is that uh, don't try, try to complicate. Make it very simple so that the person understands you very clearly. Okay, so you don't have to have long sentences and things like that. Make it very short, very precise, to the point, and make it very simple so that the person listening to you is can easily understand what you are here or whatever statements you make. Okay. So with that, let's get to the okay. Anyone has any questions with regards to the introduction, the greeting, introduction, and anything? Do you have any questions? Okay. Okay. I presume that there are much. I think there is a question. Okay, sir. Okay. 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 See, I hope that there are no much questions with regards to the um, the introduction part and things like that. Okay. So let's quickly move on to the tasks. Okay. So find out if there are any questions concerned before you administer vaccinations. Okay. The first thing is that is the first question. Okay. Um, I've just told you, yesterday that when we start with our conversation, or when you start to do something, or when you're going to start or to apply a procedure or to a patient or anything, you need to first ask a permission. Okay. So in this case, we are not going to ask the permission to the child. Definitely, whoever is responsible for the child. Okay. So that is the first question. So, or maybe you don't have to. Uh, um, Maybe you can put it like this. Okay. How do you feel about the administration of vaccination to your child? Okay, or to Clara. So that is some sort of question which you can put forward so that you get an idea about whether they are okay with the vaccination or not. Because first we need to understand whether the person whom you are speaking to or the carer is ready to accept, or he is willing to accept vaccinations for his or her child. Okay, so we need to get that. We need to know that. Then that's the only way. Otherwise, we just start with the explanation, and all of a sudden the patient says that I'm not quite comfortable with the vaccination. So whatever you said goes on a wane then. Yeah. So basically, what you need to do is you need to do it in a proper way. Okay. uh, Maybe you can before you start, you can also structure your speaking. Okay, you can tell that what are the things you are going to tell them. So basically, you are here to administer vaccinations, about the vaccination. So you ask the first question. Maybe after that, you get this information about whether they are ready or not with the vaccination. Okay, so uh, after that, okay, once you get the consent, you go to the uh, second task. Okay, explain the parent has the right to refuse vaccination, but emphasize the lack of evidence that vaccines cause autism. Okay, see, what if the patient or the patient carer says that they are quite, you know, uh, concerned about the vaccination. Okay, they might say that they might say that the vaccination, they have heard that vaccinations can cause autism. Okay, maybe they might have got some sort of information from somewhere. Okay. Okay, Danya Raju has a question. So we have a baby here. So for addressing and giving information, can we ask the name of the person who is there in home right now? Definitely, yes, yes. You can. So definitely you can address the patient, so you don't have any sort of difficulty in addressing the person as such. Okay. So absolutely fine, Danya. That is a very good question. Yes, you can ask the name of the carer or the person who is there at home or who is responsible for the child. Yes, you can come up. You can ask with that questions. Yes, it is a part of building up rapport again. Okay, that's absolutely good. And yes, so coming back to the second task, after the first question, you placed in um, about asking about the administration of vaccination. Maybe the patient or the carer would come up with a question that they are quite confused or they are quite um, you know and they might have a intuition that if the vaccines are being taken, that could be a cause to autism. So definitely, maybe the interlocutor or the person who is sitting in front of you might come up with this question, and that would definitely, you need to explain that. So when you get that question, um, you need to first acknowledge their you know concern. Okay, you could definitely say that I really I can feel that how you would be feeling at this point of time, having this information with you about the cause of autism. But let me tell you the fact that the vaccinations have been tested on animals, and there are not much emphasis, and there are some the evidence with regards to the vaccines causing autism is not that that has much evidences. Okay, so which wherein by providing that information, you can actually uh, you know bring down the concern of the person, okay, about the cause of autism is because of vaccines. Okay, you can state that there are not much evidence with regards to that. So basically, you need to assure, uh, you know, the patient or the patient's carer about the situation. Okay, and you also put in the comments that definitely yes, as a parent, you can have the right to refuse vaccination, wherein you are not going to force the you are making a point that you are not going to force the carer about the vaccination. Okay, so you completely leave or you completely say that the parent has the right to refuse vaccination. Absolutely fine, but your duty is to you know uh, give the vaccination, for which you need to explain, okay, the risk. So with that, you are going to structure yourself. Okay, so you can ask permission that to the carer that would you like to discuss about the vaccination, the advantages of vaccination, and what are the causes, if not the risks of having explain the risk of not having the vaccination. So you can structure yourself, okay, stating all these things. What are the diseases? What are the fatal conditions which may cause? Okay, so you ask the permission so that you can um, discuss about this. So you place a structure in front of the carer. Okay, so why I'm not saying those sentences to you is that I want or I don't want to create a sentence and give it to you. Okay, it is because I want you to open up your mind and think about how to create sentences and how to structure or organize the sentence, or how to organize this and to form a sentence. Okay, I want you to do it by yourself so that you enable yourself to create sentences and enable yourself to bring up with ideas. Okay, so is that clear? So do you have any questions pertaining to this right now? Okay. Yeah. Okay. Till now. Okay. 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 So, anybody has any sort of questions? Please feel free to ask any sort of questions. Absolutely fine. No problems. I think today I'm quite short with some questions. I hope everybody has. That's the feeling which I'm getting right now. That everybody has understood the class very well, and you don't have much questions. I hope you would be able to do a good speaking uh, from now. Okay, okay, yeah, that's good to know. I mean, I feel quite happy, and with regards to this situation here. Okay, okay. At least my idea is to give you a good understanding about speaking and how to do this. Okay, so that is what I'm trying to do um, with this sessions. Okay, so any questions? So do you have any questions? And okay, with that we come towards the end of the. Okay, I have Kavita George asking question. Is it necessary to ask to or confirm that it's Clara's home? Yes, it is. It is very necessary to ask because you are doing a home visit, right? So it is very important that you are at the right place. What if you are at the wrong place? Yeah, but you are not. As per the scenario, you are not. Okay, but it is good to ask these questions so that you can build a rapport between the person. Okay, so otherwise, you directly barging into a home wouldn't be right. Correct? Okay, so you ask and clarify whether you are at the right place because in foreign they have a digital record. I hear it like that. Uh, Yes, it is always good. Yes, even though we have, see, we have the address, we go to the right home, everything is there. But it is always good that we reconfirm with them, yes, whether we are at the right place. You know, the records can make some sort of errors, right? Or it can, it's the records have been created manually, so there are possibilities of errors, right? So it is always good that we confirm ourselves so we can assure that we are at the right place and it's good for us. Yeah, in real scenarios it would be good. Just imagine yourself being a community nurse and you goes to a place and you go, you explain everything, and they say to you that we don't have any children out here at our home. Just imagine that situation. Yeah. So, I'm talking about the real life, not on just in the perspective of the test day, but also on the real life scenarios. Okay, so that is what OET is trying to do. So that is what OET is also expecting you from doing this mock session or the speaking test. Yeah. So it is always good that we confirm ourselves that we are at the right place. Okay, so if you practice in this way in your real life as well, uh, uh, Tina Stephen asked, should we ask, can I come inside? Yeah, definitely yes. So keep also things in mind that when you ask all these things, you are taking a bit of time, and you need to do your explanation, you need to complete your time, and all you have is 5 minutes. Okay, so don't go too much into personal questions or things like that. Make it very professional. Okay, can I come inside or may I come in? Is fine, absolutely fine, no problem, Tina. Absolutely fine. Yeah. Okay. Okay. What if parents are not compromised with my information and say no? Should I stop the conversation? See, as we have here, they have all the rights to refuse vaccination. Okay, like you have a scenario, or like you have a card. Okay, even the interlocutor. okay, also would have a card. I would like to show that to you as well. So let me just quickly show that. Okay. Okay. So this is the card which an interlocutor, okay, would also have. They also would be following some tasks. Okay. So if you just read through it, the first task, okay, explain that you're worried about the vaccines may cause autism, and you would prefer not to have your child vaccinated. It's definitely this would come in. Yes, they would have a doubt. Okay. Then it states that accept the nurse's explanation, but explain that you want to avoid giving your child unnecessary medication. Find out if there is any benefit from medications. So, this is correlated to the task which you have to perform. So some sort of and there is a matching situation here. So they are even the interlocutor has to follow would be following the same. So you do not have to worry about the things, but there would be scenarios where or the tasks where the interlocutor have to be um, adamant about certain things, or they might not agree to you until they are quite convinced about what you're saying. Okay, for convincing them, you need to have more convincing power. I would say that all you have to do is like make it very simple, so that they understand it. They don't, be very rude to you or anything as such, but you know, try your best to do it. Okay, to convince them with the information which you have in front of you in your role play card. Okay. See here also again the third task: express confusion as you thought conditions like polio and whooping cough had been eradicated. Can't you just make sure they stay away from the infected people? So all these things, is plays a role. So it is all related. So whatever you speak is related. So you have some sort of, you know, um, uh, connection with it. So all you have to do is, you need to persuade the patient to, or the person to get more information as whatever their concerns are. So you have to ask questions, open-ended questions, so you get these informations from them. Okay, so that it would be very easy for you to explain and to go as per the task which has been given to you. Okay, so here it states, finally agree to have your child immunized. So they would definitely, come to you, but you have to lead that, or you have to basically lead them to that. Okay, so you will not be able to see this particular role play card, that this is actually for the interlocutor. Okay, it will not be seen by you. You will be only allowed to see the role play card in terms of nurse, doctor, or whichever profession it has. So make sure that you lead them to these questions. For example, you have this here, explain the risk of not having vaccination. So this would actually confront him or the patient or the patient's carer that, these things are. And you also include a contract whooping cough, hepatitis B or polio. So based on that, the patient is going to ask you further questions, right? So the patient, in that task, it states that the patient is asking you a question. The patient is thinking, or the carer is thinking that the polio and whooping cough has been eradicated. It has been removed from the, from that country or from that locality. So what is the purpose of taking it? So then you have the, task there to explain. So you can explain about this. So that would add the right way of explaining. So I would say that speaking is quite easy, but if you just have to follow all the things. Okay, at the end, okay, I have Shika asking a question. At the end, mother still not convinced to administer vaccinations. Can we close the conversation? It costs to reduce At the end, the mother's still not convinced to administer vaccination. See, um, we need to find the reasons why she is not convinced. Okay, so you can ask questions about what are the. You're not forcing her to take the vaccination for her child, but uh, you can ask questions. What is the reason she is feeling this problem? And if you see, Shika, that in the task which is there for the interlocutor also, he or she has to follow that. He or she can't move out of that. So there's a task being given to the interlocutor or the person who is sitting in front of you. So you don't have to worry about that. All you have to do is just follow your task. Everything would be in place. So you don't have to have that mindset that he or she would not be convinced with the vaccination. Even if you're not convinced, let's take the worst scenario. There could be situations where, the interlocutor wouldn't be convinced. Maybe the task for the interlocutor would be not to be convinced with the, explanation or things like that. But still, you will not lose your score, even if the interlocutor is not convinced with your speaking. All you can do is like keep trying, keep the conversation going for the 5 minutes. Okay, for the 5 minutes until the interlocutor tells you to stop. Okay, keep on going. Just keep trying from your side. So is that clear, Sika? Okay, okay. So okay, and any further questions? Okay, I hope Murugan is typing some questions for me. It's all about the conversation skill, right? Um, yes, it is about the skills. Yes, yes, that is what it's all about, right? Learning a language. Yes, definitely. It takes a lot of skill sets to be there. Uh, Apart from that, you also need to have a see. You need if you have good communication. If you have a good communication, if you have a command over the language, it will be very easy. So, but I'm not saying that people who does not possess that great skills to communication will not be able to pass OET. You can definitely clear the OET. All you have to do is practice. See, practice makes perfect. That is what that's everybody knows that. So all you have to do is put yourself some effort. Do yourself some speaking by yourself, looking at the mirror. Practice yourself about with different scenarios and different modulations, tone, registers, all these things. And keep in mind about different criterias when you're speaking. And also, when you're doing your speaking, try to record those speaking and review that and see where you could have developed or where you could have put in more things and within the time where you could have used a better sentence construction or a better way of asking or what you could have improved in that conversation. So analyzing yourself would definitely benefit you to get a very good or to attain a very good speaking. Okay, so try to do that, and to an extent, I'm sure that you would be very, confident because all you're doing is that you are actually using these scenarios, health-related scenarios. That is a very good. That is one of the advantages which you have in this particular speaking. So, as I told yesterday, that it is not about your medical knowledge is being assessed here. It's all about your speaking skills or your communication skills. Okay, it's completely that. So you do not have to worry about what you know or what you don't know about in the medical, whether you don't possess a very good medical knowledge or not, doesn't matter. Okay, it's all about speaking. All the things, all the tips and tricks which would be mentioned in the task. So you can use them. You can use those. Okay, you don't have to have all these things in place. So, but what I would really recommend is that if you could use the right amount of words and sentences and avoid repetitions, avoiding the same usage of words which is there in the let's say role play card. Okay, use similar words and things like that. Okay, you before when a conversation or a speaking starts, you get 3 minutes. I told you about that. You get a preparation time of 3 minutes. In that 3 minutes time, you formulate yourself the structure, the questions, the similar words which you can use. Write it down on the paper. You can even look at those papers and points when you're speaking. So it actually enables you to do a better speaking. You can even look at the questions which you have created within that 3 minutes. But you should not make the other person feel that you are having a long pause or interference in between during your conversation. Okay, so those things need to be taken care. With practice, you would definitely attain all these things. Not to worry. Uh, it's all about how much effort you put into uh, to attain these skills. Okay. So any further questions? You're welcome, Ruben. Yeah. Okay, Hema, no questions, no questions. No, thank you, sir. Okay. I hope all of you have got an idea about speaking, yes, and the criterias. Okay, okay, good, good, good. Okay. So I hope everybody is quite okay with it. And maybe I might come up with, many more role play cards, and we would discuss about different situations and different scenarios on later on days. And again, I would like to tell you that, practice makes perfect. So keep on practicing. Mm, Shika, what I could do is I don't have those with me straight away. If you may contact the IRS straight away, you might be able to get some, role play cards sent to you. So you could use those role play cards to practice maybe within yourself, and maybe you could, practice within your friends and colleagues which would through over the phones. Yes, as we are all being requested to stay at home at this particular point of time. Yes, that's the only option where you all could do your practice, or you could do your role plays, considering or imagining you are having the other person in front of you and recording that and listening to it. So these things would really really help you to attain more confidence and more attain more skills while you're speaking. Okay, so and analyze your speaking in terms of these criteria, whether you have met all these criteria during your speaking. That would really really help you and to improve on your standard of speaking. Okay, and also if you could look at different IRS has different audio samples which is being placed on YouTube and things like that. So if you could look into that, that also would help you with all these doubts and different scenarios and role plays. Okay, so I hope everything is very clear to you. And as in today, if I hope there will be, I'm not so sure whether there will be a class tomorrow or not. With regards to that, there would be an intimation sent to you onto your email address if there is a class to be conducted tomorrow and things like that. The intimations would be sent to your email address by evening or yes, writing sessions would be coming up, honey. So don't worry about it. There would be maybe myself or maybe another person would be taking you through the writing sessions, and definitely like the same webinar sections, you would be free. You will be free to ask questions, and whatever questions you have, please prepare and keep it ready for those people and for anybody who comes to you with regards to all these informations, okay, all these webinar sessions, okay. So with regards to this week's class, you would be intimated through email, or you may quickly may have a contact. Hema, I wouldn't. I'm not so sure about that. Will you continue the same role play card tomorrow, sir? Why is that, Hema? Were you not able to grasp the information? Because I'm just curious about that question, Hema. As I said, Hema, I'm not so sure about whether I'd be taking you the sessions tomorrow or not. As I said, it would be intimated. I would also get the intimation from IRS with regards to the same. Okay, so nothing to worry about. You would be taken care, and we also have certain classes coming up for you with special rates and things like that, which has been advertised by by the IRS Group. For further information, you may log on to the to the Facebook page, that is IRS Group, and you can get those informations from there. And you may contact the our IRS Group on their number, which is 9020 200 500. Okay, until now we have seen the greeting, so I wish to get practice about the forming structure and further steps in role play. Hema, what I would really suggest is that greeting, yes, yes, okay. What I'm saying is that the greeting is almost the same with most of the people. So, why I did not do the practice of forming structure and further steps in role play is because I want you to, individually, I want you people to create your own structure, because each scenario is different. Yeah, we can only formulate or form a certain forms of greeting and introduction. That is something which can be standardized, but formation of structure and further steps can't be formulated. It depends on it changes or it varies on different scenarios. So if we provide that structure, most of the people candidates, what that is what I have seen in my during my training sessions. Students intend to follow the same structure for all the role plays. So that is why I request you to form your own structure. So all you need to have this idea of how to form the structure. I've just told you, right? You can explain about the advantages. You can explain about the disadvantages. So you can state that, and just when you're speaking by signposting, you move on from one to another. Okay. As I said, what a signposting is basically, telling the patient that you are going to explain this now. So this is a signposting. Okay. So if you have this idea in place, definitely you will be able to formulate this. And also, watching different videos of speaking. I can come up with different videos um, in later on classes. Definitely, I could do that. Okay, so soon I would come up with that, and if that is what you require, all of you require, then I can come up with other videos so that we can discuss on that and see how they have, used or capitalized each situation. Okay, so I think that is clear to everyone. Okay, any further more questions? No, no. Okay, okay. So I hope today's session was quite, um, helpful to you with regards to your speaking practicing. Okay, I hope everyone had benefited from this session. If you do have anything, please put on your comments on our on our Facebook, so that we could look into that and try to overcome all these things from there. Okay. So till then, till I see you later, have a good day ahead, and stay at home as um, the country has requested us to, be cautious with regards to the situation here, and please be, take care of yourself and uh, keep safe of yourself and others as well. Okay. Have a wonderful day ahead. Thank you.